Hi everyone. So as promised, today we are live with our another Insta live session in which we talk to our past patients about their experience and their surgeries with us. Today we will be joined with a couple of sisters who had their own body contouring surgeries and other surgeries with us. They flew in from US of A and last month, around 4 or 5 weeks back, and they had their surgeries with us. And they will be sharing about their whole journey, whole experience, how did they decide to come to India, and what has been their result. All those of you who think about cosmetic surgery, are contemplating, can also discuss with them their experience and ask about all the discomfort they had, any complications, side effects, and let's make it a very interactive session in which you can see what has been their experience. Hello everyone who is joining it right now. We have seen that in our past, most of our patients have, most of our people who follow me on Instagram enjoy such sessions since they get to interact with people who have had their surgeries with us. So let's see, I'm waiting for them to join. These are Kajal and Kamini sisters. They've still not joined me. We are waiting for them. Meanwhile, if you have any questions, please ask me, and any questions you have. Someone asked, do you perform rhinoplasty on your own or by other plastics mentioned on our website? So Mr. Suman, so we are a team of plastic surgeons. Rhinoplasty is performed by me. I am known to do good rhinoplasties, and we enjoy doing rhinoplasty by myself. So yes, rhinoplasty is performed by me. Please get beta pilang on your face, better lighting on your face. I think it's fine. I don't want to change location. It has good internet right now. So I'm just messaging them. They'll just join me. So if you have any questions, please ask. So a lot of people ask me about, doc, is cosmetic surgery very expensive? So I tell them it's the way you look at it. It's not expensive if you see the impact it makes on your own personality, on your own goals, on your aesthetic goals, as well as how much happiness it can give you. So yes, it's not expensive in that sense. So thank you Shweta ji, thank you Dr. Morgil, so for appreciating our work. So Kajal has just joined me. Let me just invite her for Kajal. I think you will have to update your app because your app is not updated. I can't send you a request. Karan, yes, buccal fat removal can make face slim. Of course it can. So let's see. Okay, so Kamini, I've invited you. The request, please press yes. Hi, how are you doing? I think Kamini joined and then she left. Some internet issues. Hi Asim, how are you doing? Hope to see you soon. So, hi, here you are. There is some internet issues happening, Kamini, at your end. Please look at the internet, maybe from another number, and join. So someone has asked me a question whether there is any procedure for eyebrow lift. Yes, there is. There are multiple options for eyebrow lift. Depends upon what's causing your eyebrow to sag. So it depends upon that. Simplest is Botox. The most advanced is
okay, it worked. It worked.
Yeah, hi.
Hi.
Yes, you are here. How are you?
I'm
I can
well.
only
How are
see you.
you?
Where's your sister?
Let's leave it here.
Hey, hi. How are you,
Hi.
girls?
Sorry, that I think it was the internet, or we were trying to connect from the computer so it would be easier, but then it worked on the phone.
Yeah, it works on the phone. Insta Live works on the phone and not on laptop many times. Okay, so hey, welcome. Thank you for doing this. I can't see you both. Can you station your camera just a bit far away so that I can see you both and we can have a nice chat? People who contemplate cosmetic surgery, who have questions about cosmetic surgery, about patient experience, can please send in your questions, and I'm sure Kamini and Kajal will be here to answer them. So, guys, Kamini and Kajal flew all the way from New York, USA, to get their surgery from us. They were supposed to come to us in March 2020, before COVID hit us. Am I right?
Yes, I was supposed to come in, 2019, and then I booked it for 2020, and then Delta hit, and then finally in 2021, I finally got to come.
Yeah. So then the COVID hit, and then you planned again, but then the second wave came. But finally, you were here a few weeks, couple of months back, and we did your body contouring. So they had their body contouring liposuction from us. They both did, as well as their buccal fat removal. And I can see your chiseled face as well right now.
Oh my God, when I got back to America, everyone told me that my face looked so much skinnier. And I got messages on Instagram about people asking about buccal fat removal. And I think that it was 100% worth it. I was even checking on Real Self, and 98% said it was worth it, but it made a huge difference. I just had to wait 3 weeks.
And we also did your fat transfer to your teardrop, hollowness in your cheeks. How is that going on? How is that looking?
Yeah, I had dark circles before, so I got fat implanted here under my eye, and it made a huge difference too.
Yeah. So I'm glad we did. And while you're sitting, I can see your deltoid groove, which we created. Hi, Nikhil.
I know today I didn't wear my faja today because I just wanted to come on live and show I'm fit into it extra small. So I was so excited.
Yeah. So,
and I have no stomach. This is crazy.
yeah. I saw the other day you sent me pictures that you are having an abs, but I'm really liking both of your deltoid grooves as well. The arm sculpting which we did has given you a nice shape.
Yes, it's really nice.
So both of you, can you please tell our audiences how did you decide about these surgeries and how did you plan to come to India?
Because you picked. Yeah. So I came to India because I was looking at surgeons here. A lot of people said that over here you can't get it done all in once. So they said, we'll do your arms one day and then we'll do your stomach one day because they keep you awake. And the cost also, but most importantly, because I was like really worried about getting, do you know the word blotched? I don't know if they use that in India.
Yeah, everybody there uses if something goes wrong.
Yeah, so I was really scared to come to India because I didn't want to get blotched because I was like, I don't know if I'm scared if it's not going to come out good. And I heard a lot of stories about people getting lumps. So I was really scared because I didn't want lumps on my body. And I did so many research. I did consultations, and you were the best one.
Thank you for saying that. So, how was your travel experience, your online consult, and then I think we provide quite a bit of concierge kind of service. My patient coordinators do keep connected with our patients, isn't it?
Traveling experience, it was really easy. I just booked everything online. Hotel, I went through Expedia, so everything was. And I know someone won the Olympics while we arrived, so the airport was having like this crazy party. But I think the wrestler won in Delhi. He landed at the same time we landed, but everything was super easy.
Yeah. So, and how was your experience with the hospital and the infrastructure at our hospital? What do you have to say about that?
Oh, the hospital, it felt like a 6-star hotel. It was really luxurious. Are you still at the same one, or?
Yeah, I'm still at the same one. I've joined one more new hospital, which is equally luxurious, if not more. So I only work in that kind of setup,
Yeah, it looks so nice. But yeah, no, it felt like we were in a hotel, like a 6-star hotel room when we arrived. The bed was nice. The curtains like automatically go up and down. And there's like a lounge area for your family or guest as well in your room aside.
Yeah.
So it was really nice.
So now the big question: How much difficult was the surgery? How was your experience of surgery? Painful? How was it?
So I'm not gonna lie, it was actually it's not like everyone says like, oh, it's easy or something. It's definitely hard process for a week. I would say, right? 2 days, 3 days. Definitely the first week was hard, but the first 2 3 days was really tough. But it was definitely worth it. Yeah, it was so much.
So, I still remember Kamini's words. मैं पहले 2 बच्चों की माँ लग रही थी, अब मैं 9 बच्चों की माँ.
Yeah, first I said that because I was telling my husband like पहले मैं 2 बच्चों की माँ लग रही हूँ और अब मैं 9 बच्चों की माँ लग रही हूँ. Because if you see before and after, like my stomach is completely gone. It's crazy.
Yeah, and you have got that. We did high definition contouring for you, and we have got that edges of muscle and the central lab etching which we did. It looks really nice and give you an aesthetic look, isn't it?
Yeah. Do you want to hold the camera at me, then? Yeah. Someone just said on one of the comments that Dr. Gupta is a professionalist, and he definitely is because
thank you for saying that.
So insane. Yeah. My arms, it looks like I like lift weights or something, and then I could move my stomach down, but yes. And then this is like side view.
Yeah, this is just 5 weeks. Our result will improve. This is just 5 weeks.
Yeah.
Yeah. So thank you, Scheme Nikhil, for saying that. Yeah, we love our work and we know what we do. So, you see, a lot of people have apprehensions going all the way from US, especially COVID times in India. How safe was it? If you can just bring that out, that did you feel safe or insecure at certain point of time while you're to travel to our hospital?
Yeah, actually, I feel like India takes more precaution than America does because we had to wear our mask everywhere we went. We had to wear it in the cars. There was a fee if the
you would get fined. You would get fined if you don't wear a
yeah,
mask.
I was so shocked. I was in the first day I got a taxi to go to my hotel room and somebody said, hey, the driver was like, put your mask on because you'll get a fine of 2,500. And I was like, but we're in a car. Because in America, if you're in a car or outside, you don't have to wear a mask. And he was like, no, it's mandatory.
Yeah. And thankfully, we don't have any Republican state in India, so everybody wears a mask.
Yeah, everybody did.
Okay. So, now, if you can just share what all procedures you did and what did you expect and how has been your result?
Okay, so I think we got a couple of things done. So 360 lipo on the abdomen and the back. Yeah. So if people don't know, it's upper and bottom. Like it's all of it. And then it goes all the way around. And then a lot of people don't know, US, it's really hard to find someone that does the deltoid groove along with the bottom. I think there's only one doctor because we researched so much. There's a group, it's called 360 Arms, Celebrity Arms in America that does it. But it's really hard to get an appointment, and they're actually located in Florida, but nobody else does it. It's really hard to find someone that actually does the deltoid groove, and you do it. So that was
show that deltoid groove. Show both of you. Show your deltoid groove. It looks it's looking so nice.
Yes. So you guys see, can you point it's yeah. I don't know if it's hard to see in here, but before her arm was like this, and now there's like a groove here. So yeah, it definitely looks like I work out. It looks really good.
Yeah, so it gives a really nice toned look out to the arms.
Yeah.
These are small things. Someone who has a thin arms, if they can get toned arms, that adds wow factor.
And my arms are always a problem area. Like I would work out so much and I would try to eat healthy, but I was addicted to cheese, but still, I mean, nothing would help my arm fat. I think it's just the way our genes are. Like if you're going to have fat in certain areas, you're always going to have fat there.
Yeah.
You never
and these results are permanent. So we did your arms, we did your 360 body, and on your face we did a buccal fat.
Buccal fat. I also got chin body tight.
Neck tight. Yeah.
Yes. Fat grafting, which means they take fat from different areas and put it to certain areas. So I got fat put into my under eyes for my dark circles. And I was going to do a nose job, but I got really scared.
Maybe next time.
Yeah, so in December, I will do it.
Yeah. So, how has been the experience for each body part which we did for you? Any part which you think is not that good or something better than others?
So I was really worried about my buccal fat removal because I researched it, and you said we were going to have stitches in the inside of our mouth, but
Yeah.
actually I didn't even notice it, and I was able to eat and drink everything. Like, you know how some people say that they couldn't open their mouths? I mean, read a lot about it. No, for a week. A week. I opened my mouth. The only thing I couldn't eat was pani puri, because you have to eat the whole pani puri, but I eat everything else.
So that's a drawback. You came to India and still did not eat pani puri or golgappa.
Yeah, I was breaking it up in pieces. I was like, I'm only in India for 2 weeks.
So how has been your recovery? It's 5 weeks post surgery. How has been your recovery? I see that you are recovering very well, although the result will keep on improving up to 6 months. And you know that, right?
Yes.
So how has been your recovery and everything?
The first week, when we first got the surgery, I was like, I remember Dr. Priya telling me, she's like, you're going to wear your faja by yourself now. And I was like, no way, there's no way I can wear this by myself. And she was like, yeah, you're going to. But 4 days I was wearing it by myself. So it was, so the first 2 days feels like it's really hard and you can't recover, but recovery is actually really quick. So by week and a half, like by the end of the week, we were doing everything by ourselves. So it was fine.
Yeah. Yeah, and it was good that both of you were traveling together, so you had similar procedures and similar kind of recovery, so you kind of knew how it's going to happen. We did both of them on back-to-back days. So if I'm not wrong, 12th and 13th of August, isn't it?
Yes, so my sister went on the 12th, and then I got to see her come out of surgery, and she was in so much pain. And then she was like, be scared, and I was like, oh my God. But I really wanted to get it done because I think it's definitely, I know they say it's not weight loss surgery, but I feel like it was because it helped me so much. But I think you just have to have positive outcomes after that: exercise, eat right, to keep your results.
So yeah, so of course it's easy to maintain the result. Of course, we recommend all our patients to exercise, eat healthy, and live a good healthy lifestyle. But these results are almost permanent. So any message to people who you think are contemplating cosmetic surgeries? Any message from you girls?
No, I think it 100% changed my life around, and it helped a lot. It definitely pushes you to go to the gym more, makes you like more. I know people are like, oh, it's bad. It's really, some people think it's bad, but I don't think it's bad. I think if you really want it and if it's going to help your life, then you should get it done. Right, Ben? Yeah.
Yeah. You, Kamini, you? Any message from you to people who think about contemplating cosmetic surgery but are scared to go under knife?
Oh my God, I would say don't be scared. I think that it was such life changing that it's like permanent results. You're actually investing in yourself because then you can wear the clothes you want to wear. You have a healthier body. You feel more confident. So I think everybody that wants to get it done, just go do it, because if I could do it, you guys can definitely do it. Yeah, and I was the most scared ever. So if I could do it, anyone can do it, because I'm scared of needles and stuff. So even when she started my IV, I was scared. But they put you to sleep, so you don't even notice anything.
Yeah, yeah. So even our anesthetists and the hospital staff are very helpful. So we are glad that we could make you happy. When are you coming back next?
December, hopefully, because I want to get my nose job done. Actually, I have a question for you, Dr. Gupta.
Please. Please ask.
So I was recovering, and I'm gonna make a real self, like with all my pictures and stuff. I'm gonna start doing a review. It's just gonna take me a minute, but I read on there a lot of people do liposuction twice.
Twice?
Yeah.
So I don't think you would be one of those. There are some people who are really bulky. If you go on my feed, there is one guy. He came from Nigeria and we did him twice.
I saw it. Yeah, I saw that.
And for them, because the first procedure was a debulking surgery or just a slim down surgery, from that we are bringing there. And then they go back to exercise and tone their muscles. And then after a few months, they come back in and then we do a sculpting for them, which we did for you in any case, the first session, because you were never that bulky. You just had resistant fats. So in such cases, we do twice, but I don't think someone like you would need twice at all.
Yeah, I was reading it, and a couple people said they got like liposuction revision like second time, just so that it just makes it like more tighter, like more snatched.
I don't think so. You would be needing them because we did your micro air as well as laser with body tight, so skin also tightens. The result will keep on improving up to 6 months. I don't think you should be even thinking about that. So
yeah, okay. I'm already. Where are you so tiny? My measurements. My waist went from 32. Right now I'm 26.
32 to 26 in 5 weeks.
Yes, it's crazy.
Yeah. So someone is asking what did they do? They did 360 liposuction, body contouring, sculpting of abdomen and hourglass shaping, and buccal fat removal and neck tight, face fat grafting. No tummy tuck needed for them. So someone is asking about your before after pictures. They have sent them. I've shared them on one of my reels. They'll send them again. Kajal, Kamini, work for you. You need to send your before after pictures.
Yeah, and you guys can hit us up and message us. I have so many pictures I can share with you guys. And also, there is no lumps. I see a lot of reviews with liposuction surgery going wrong and having lumps. Do your massages, definitely. And I think even if I didn't do my massages, there was no lumps. It was perfect.
Smooth. Yeah.
It was very smooth. My skin is really good.
Yeah, it depends upon 3 things: the tools, the experience of the surgeon, and the hands of the surgeon. If everything goes fine, it will be smooth. Yeah, and also sometimes it depends upon the patient's inherent ability of the skin to retract. So you had good skin, so obviously you will have a great result. So someone is asking what were their weights before. So Megha, please understand this is not a weight loss surgery. This is a body contouring surgery. Of course, weight loss does happen, but that to a secondary benefit. So now the questions to you girls: what was your weight before and what's it now?
Okay, I know it's not a weight loss surgery, but I was 136 before. Right now, I'm 116.
136 to 116. Great. So 20 pounds loss. That's a huge loss. I didn't think we take out that much amount of fat, but what happens is
I feel like the surgery itself, the first week I didn't eat. Like the doctor would bring the dietitian would bring like khichdi and stuff, and I'm like, take it away, I don't want to see food. But I was so happy because now I eat less. I don't know if like my stomach got smaller. I know it didn't get smaller because it wasn't like gastric bypass or anything, but I just eat less and I get full fast. And I like started going to the gym every day, so it's crazy. What about your weight? I was 126 and now I am 110.
16 pounds. So that's again a huge loss of weight. I don't think we need that much amount of weight loss for you. But what happens is once you do this surgery, give you a nice shape, you want to maintain it, right? So you eat proper, you go into a positive frame of mind, and your lifestyle changes. That's a secondary benefit of the surgery.
Yeah.
So
I also eat really bad sometimes, and I go on the scale. Maybe I gain like 111, 112, but I go back to 110. So
so you go into an image and a mindset that you want to maintain that shape. So that's why. Someone is asking, cosmetic surgery mostly goes wrong and is scary. Can you just tell that nothing went wrong and it's nothing to be scared?
Yeah, it's definitely nothing. Well, actually, I would trust Dr. Gupta like 100%. We did our research a lot, and there's so many doctors, and you actually have a lot of before and after pictures on your website, and I think on Real Self too. There's so many comments with real people, and like you have us when we go live and talk about our experiences. So yeah, nothing to be scared of.
I hope you know that I am also now the first international advisor of Real Self.
Yes.
So,
so it's amazing. It's really amazing. Yeah. Actually, I was so scared. One doctor in America told me, because I was 136, they said Kajal was a good candidate, but they told me if they did liposuction on me, I would have loose skin. So they told me I wasn't a good candidate. So I was like, oh no, I don't want loose skin. He's like, I'll do liposuction on you, but your skin's gonna sag. And I was.
Has your skin sagged? Has your skin sagged?
It didn't sag at all.
Not at all. So we use tools like Razor and Body Tight. So the skin tightens with those tools, and hence the result tightens. The skin really tightens. Someone is asking that eyelid drop to get normal after Botox around the eyes. So Ritakshi, I'm so sorry that you had an eyelid droop. I don't know who did your Botox. It usually does not happen. But if it has happened, it will take around 3 to 4 months. Ash Virat, someone is asking, does age play a role in recovery after surgery? Older people can recover well post-surgery. Yes, it does not depend upon age, actually. It depends upon how healthy and well-being you are. We do all the investigations before the surgery. Remember, Kajal, we did a battery of tests for you before the surgery. Similarly, we do tests for all patients. We find out that they are fit for surgery, and then we do it. And if they follow proper instructions, the recovery is pretty fast the way we do the surgeries. Of course, it also depends upon individual pain threshold and their body and recovery. But usually a week to 10 days time is more than enough for them to recover. So, it was a nice and entertaining discussion today with you. Do you have any questions for us?
No, I know. I was talking to one of your patients that got buccal fat removal, and she was worried about her results. It definitely took me the first 2 weeks. It's definitely a lot of swelling, so you don't notice. Third week, it's just plug it in. It starts going down, and by like 3.5, 4 weeks, you can definitely see your results. So.
Yeah, I usually tell that 6 weeks you see the result. So I usually try to underpromise so that the patients are happy. If you remember, I must have also told you 6 weeks you will see the result for buccal fat, but at 5 weeks we can already see your shape of face.
Yeah, it's so amazing. It came out really good and everything.
Someone is asking, can you give any kind of nose for rhinoplasty? No. No surgeon can give you a nose if you get a picture of a model and I want that nose put on my face. No, Ritakshi, it doesn't work like that. We need to work on your own anatomy. So once someone comes to us, we assess them, we see what their bony framework is, what is their cartilage framework, and then decide what needs to be modified to give them their desired shape. So we can go along the direction of the result you want, which will be very similar, but it should suit your body and your face as well. So these are the things which goes in my mind when I assess any patient for any part of the body and then decide about the surgery. And as I say, always keep it looking natural, isn't it?
Yeah, you always say that.
Yeah.
And he you know exactly what you're doing. So just trust him. Go through your consultations. And Dr. Priya was amazing. So was the anesthesia team. They were I was scared actually because I've never been under anesthesia. So going down to the operating room, I can't remember the doctor's name that was the anesthesia, but he introduced himself.
Dr. Tara, Dr. Veenu, Dr. Rahul, Dr. Malvika, Dr. Suman. So they're a huge team of 5 people.
Yeah. But he started cracking jokes with me and making it funny, and I was laughing, and then he's like, don't worry, you'll be fine. And I was like, okay. And he made me feel so comfortable, and then by the I don't know, it was so quick, I don't even remember. It was so fast. I have 2 questions. Sorry. What do you think of liposuction after having kids? Do you think my body will change if I have kids now?
I don't think, your body will definitely change when you have kids. You'll grow big. Your muscles will go apart, your skin may sag, you may have some pockets of fat, but we'll discuss once you reach there, right? So I don't think you are pregnant right now. So once that happens, you have kids, you complete family, then we'll see depending upon how much skin laxity or muscle separation you develop. And
we'll
then
come back for a tummy tuck.
If needed, yes, I'll be more than happy to help.
I think you have to wait 6 months, right, after lipo to get pregnant. You have to wait.
There's nothing like that you need to wait for 6 months. You can maybe after a couple of months you can do it, but yes, your result will keep on improving up to 6 months.
Wait, someone asked.
Someone is asking, is razor liposuction best way to treat double chin? Razor liposuction along with neck tight. That's the best way. It also depends upon how much amount of double chin you have, how much skin laxity you have. So you need to meet a plastic surgeon with experience in these surgeries. Someone is also asked, is there any danger in gynecomastia surgery? So you see, if done by a good surgeon at a good center, cosmetic surgery is good. It depends upon who is doing it and in which operation theater and the hospital. So I always call them airbags. We have lots and lots of airbags, surgical airbags in our operation theater so that everything is kept safe. It's very similar to the airbags in the car. So it was lovely chatting with you girls today after so long. We can go on and on. But thank you for doing this. Thank you for going live and discussing with our audiences about your experience. I'm glad that you are happy and we have given you a nice shape, and your shape is going to improve only with students.
Oh my God, I'm so excited.
Yeah, it's been amazing. It's really.
I look like I've been going to the gym for like 10 years.
We joke around, but it kind of made us look like Shilpa Shetty, the actress.
I threw all my clothes away and I got gym clothes. Like before, I could never wear this shirt. This is crazy.
Yeah.
Like I'm like, oh my God, this is amazing.
Yeah. It's
So, yeah, I'm glad that we could help you. God is kind. Stay safe. I heard that COVID is going again bonkers in US, so please stay safe, wear mask, and hope to see you soon back in December then.
Okay, bye, Dr. Gupta. Thank you
so
guys.
much.
If anybody has questions, you're more than welcome to message us. We'll
Yeah, so people who have questions regarding body contouring, you can connect them. They are more than happy to guide you and help them. So great, Kamini, Kajal.
Wait, can I ask one more question? Sorry. Sorry. What's the difference between traditional lipo, laser, and vaser? Isn't laser like not as much as invasive as vaser? The L versus the V?
So yeah, I know what you're saying, the L and V. And we have both in my office. We have laser as well as vaser. So the laser is the new kid on the block. Vaser has been around for the last 15-20 years and is regarded as one of the best tools for body contouring. It tightens the skin along with the emulsification of fat, decreases the tissue trauma, so you have faster recovery, less bruising, less swelling, less pain. But the most important part is it tightens the skin. Laser is again a new kid on the block, and I'm one of the KOL for a new brand which has developed laser, one of the first in the world. It's also good, but it's not that much proven as much as vaser has been.
Yeah,
So,
I know a couple people that did laser and they said they didn't see any difference.
Yeah, so I would not like to comment on why, what they, who did, and what happened, but both of them work. It also depends upon the surgical skills. It's an important discussion which I always have with my plastic surgeon. I'm starting a training session for next 4 days with few plastic surgeons visiting me from across the country. Who was the most important for Ferrari to win Grand Prix so many times? Was it Schumacher or was it the car?
No, that's
I lost you. Hello. So the point is, the tools as well as the surgical hand, both are important. Ferrari has not won that much after Schumacher, and I'm sure Schumacher won because of lovely cars he got. So the tools as well as the surgical hands, both are important to give you great results. It was lovely talking to you girls. We have lost you right now, probably in the internet connections. We'll catch up again later on. And we had a lovely live session. If you have any questions, please DM us. Me and my team are always there to help.